Hi, it's Hugo Minnaar again from Hugo Minnaar Incorporated. I'm going to talk to you about PICC lines, just the long and the short about PICC lines, when to insert them, when not to insert them, and just quickly how to look after them. So which patients needs PICC lines? So those patients that requires a CVP is also a candidate for a PICC line, especially those patients that's going to need a CVP for longer than 14 days. For those patients, I would rather elect on a PICC line. The PICC line can stay into the patient for at least 6 months to 1 year. So if well looked after by the nursing staff and the patient, you don't have to change lines for about 6 months to about 1 year. Which patients do we don't put in CVPs? Patients with active infections in the arm. We are very careful in patients with pacemakers that's inserted into that side specifically. We don't put PICC lines for patients with injuries to the upper arm. But all in all, there's not a lot of contraindications. One big contraindication is if the vessels is not large enough for a PICC line to be inserted. So my general rule of thumb for patients, if you have to change your CVP more than once, consider a PICC line. You get 1 lumen, 2 lumen, and 3 lumen PICC lines. My go-to PICC line is a 2 lumen PICC line from Vigon. It's not a lot of equipment or not a lot of things on the pack. Everything that you have to use is on the pack, and it is quite easy to use. PICC line is secured with a stat lock, or it could be sutured, but preferably a stat lock. That stat lock have to be changed every 7 days, and when flushing your line, you need to flush it every day with a pulsation technique. So you will draw up about 5 ml of saline, and with a pulsation technique, flush all your lumens. So in short, a PICC line is a CVP inserted in the upper arm. In further videos, I will talk about things like FIC lines, femorally inserted central catheters. So it's PICC lines that's inserted into the femoral vein and then tunneled closer to the knee, and also PICC ports, which is ideal for your chemotherapy patients. Everything you can receive via a CVP, you can get via a PICC line. I will talk to you again very soon.